Hello, friends. Welcome back to another great conversation. Today, we are joined by the wonderful Melissa Kramer. Melissa is here to speak to us all about UTIs. She is a PhD researcher. Melissa is also founder of Live UTI Free, and she also has a lot of experience in UTI with recurring infections, and she's going to share a bit of her story with us. I'm excited to have this conversation with Melissa because many of you do deal with UTIs and one of you specifically right now. And I was telling Melissa that I've never had a UTI ever. So apparently I'm a unicorn for that.
Mhm.
So, Melissa, welcome. I'm delighted to have you on the podcast. How are you
Yeah,
today?
thanks for having me. I'm excited to have this chat, and I'm getting over a bit of a cold, but hopefully the sniffles don't interfere too much.
I know I'll be sniffling too. So we want to look at your story, if you don't mind,
hmm
and just share because UTI is obviously a specialized category of health. And as I always say, our mess becomes our message. There's always a reason why a practitioner gets into a specific area.
hmm
Like one of my main focuses is hypothyroidism because I have hypothyroidism, but
hmm
you've had a lot of experience with UTI. So, can you share a bit about your journey? How it affected your life overall, like your
hmm
quality of life, and then what brought you to say, okay, I need to do something about this. I'm going to set up the UTI Free Foundation and so on.
Yeah, sure. So I actually started out in a different area of business. I ran a company in Australia that was in fashion and retail. And when I came to the point of wanting to sell that business and move on, I was going through so much stress in my life. And I had one UTI about 9 years earlier, but it was treated, and I never thought about it again
Yeah.
until this really stressful time of my life. And I got a UTI, and I thought, well, I've had one before, it was fine. I got treated, but this time it just kept on coming back. And it's a similar story to what we hear a lot from our community, that you get antibiotic treatment, your symptoms go away, but then a couple of months later, you get another UTI. So you just like rinse and repeat. You do the same thing over and over. You get the same antibiotic each time for the same amount of time. You're okay for a while, and then your symptoms come back. And for me, I had sold my business and I moved to Greece. So I was living in the Greek countryside by the sea, and I started to get UTIs there, and I didn't have access to hospitals. I had antibiotics with me just in case, and I
Mm.
had to take those. But my symptoms and my recurrence of UTI just started to get closer and closer together over the course of a few years, till the point where I just had symptoms all the time. There was no minute of the day where I didn't have some kind of bladder symptoms, and I would get sweats and chills or fevers, and I could always tell when it was about to escalate. And I'd seen doctors in many countries at that point, and all of them just kind of had the same approach. So they would all just say, we'll do a standard test here, take the first line antibiotic, and it wouldn't work. And then the antibiotics started to have problems or cause problems for me too. I was getting like itchy skin. I was sensitive to all kinds of food. I had more digestive problems. And I felt like I couldn't just keep on doing that. So I had to do a lot of research myself. And I did end up finding a primary care clinician who was in kind of mainstream medicine, but also on the functional medicine side of things. And she supported me in looking at different aspects of my health, and I ended up making a lot of lifestyle changes, looking at my hormones, my diet. I took antimicrobials, natural antimicrobials, probiotics. I just basically changed everything that I was doing. And then over the course of about 10 to 12 months, my symptoms started to subside until I didn't have any anymore, and I didn't have to take antibiotics or any of the supplements. But having said that, I was fine for about 5 years until I had surgery for endometriosis a couple of years ago, and I ended up with a catheter associated UTI, and the whole thing kind of started again in a different, more complex way. So I
Mm.
have different experiences, but it did help me to see that the standard approaches don't work for people. There isn't one size fits all. There's no approach that will work for everybody, and you can't look at someone else's approach and say, oh, well, I'll just try that, then it will work for me. So it led me to creating this organization where we could actually help people access research faster than you can actually find it in clinical practice. And that allows patients to kind of try things themselves or to think about different aspects of their health that might be contributing to the problem.
Mhm.
And we conduct our own research and we provide educational resources and connect people with clinicians. So we're trying to basically help patients move forward faster on their journey than what the standard approaches have been doing.
So like a support tool per se. So for those of you watching from the beginning, as Melissa said, two words there, my eyes lit up and I'm like, the word you said was stress twice.
Yeah.
Stress twice. And I'm like, yeah, that's what I say. That's what I've been saying to my client that I mentioned to you beforehand.
Hmm.
And even before we started recording, I think I mentioned to you like stress presents differently in different people. But we'll come back to the stress
Yeah.
factor. So, how did that affect your quality of life? As you're speaking, I'm getting fed up and I'm like, this is ridiculous. Where like this can't go on. And know there's many women living like this, and I know women are crying over this
Hmm.
because every day it's just destroying their lives.
Yeah, it really does impact quality of life from a mental health perspective as well as physical health. So, a lot of people end up experiencing anxiety or depression because of chronic bladder issues or bladder symptoms. And they have feelings of isolation because they can't participate in social activities as they used to. It can impact their sexual well being. A lot of people report not being able to have or do any sexual activity without experiencing UTI symptoms. So, it really impacts everything, your ability to concentrate, your ability to work, to do your normal daily activities. And I don't think a lot of that is really taken as seriously as it should be, in the
Mm,
way that women's health is never taken as seriously as it should be. But we hear so many similar stories of this, of patients being told that it's just not important, that they feel this way, and that they should be getting better, that it's somehow their fault that they're in this cycle. And that's a big problem because it really isn't. The problem is that the standard tests and treatments are not addressing the problem sufficiently.
yeah, conventional medicine definitely has a lot of holes and lacks in a lot of areas,
Hmm.
unfortunately. So, can you give us your firsthand experience on the symptoms that you had and that you see kind of most common come up with the people you speak to?
Hmm. Yeah, we've done a lot of research into this to find the most common symptoms, but some of my own symptoms were not some of the most common. So the first thing that would happen to me would often be a slight change in smell. My urine would start to smell, and or I just felt like I smelt different, which a lot of people do report, but it's not often covered in research. But then instantly I would have blood in my urine, which is kind of a scary thing to happen for someone. For me, it just was the symptom I got every single time that my
Mhm.
symptoms escalated. I was basically peeing blood. But with that came a lot of pain around urination. So after urination, you can get these painful burning sensations or bladder spasms. And I did have that. And those are some of the more common symptoms. So this pain during or after urinating, or the bladder spasms that come with that, and just the pain in the pelvis in general. So those are some of the symptoms that people experience, but I also had some of the others that are less commonly noted. So I had fatigue because I
Mhm.
was just in a constant state of unwellness, and I would sometimes get these fevers and chills that I mentioned. And it's just really hard to, it really is hard to concentrate. If you're constantly thinking about these symptoms that impact every aspect of your life, it's hard to plan for things, and it's hard to know whether you're going to be able to meet up with friends or do anything else. So the symptoms are kind of the most acute part of it, but then everything else is affected as well.
Mm. With the energy factor and the fatigue, when the body is fighting a chronic infection, as I describe it to my clients, like inside you have a constant war
Mhm.
going on, and your body is using up a lot of energy to fight that war. So, of course, you're going to be exhausted, whether or not it's UTI, yeast, some other
Mhm.
pathogen. And I love that you mentioned the smell. A lot of women
Mhm.
don't know this. Now, I have mentioned it to my clients for sure. Women, we have our own smell, each of us, and we all know what smells normal
Mhm.
to us. So, recognizing something as what's the word I'm looking for? Something as simple as that
Mhm.
can be a key indicator that, hey, something's not wrong with with my body, like even the smell, the vaginal smell, each
Hmm.
woman is different. And if you notice that changing, there's something going on there, even if you don't have the more common symptoms. So I
Yeah.
love that you brought that up.
It's a really interesting point too, and it's the kind of symptom that is less likely to be taken seriously. So if you're peeing blood, you'll probably get assistance.
Hmm.
If you say something has changed, I don't feel quite right, my smell has slightly changed, that's unlikely to get you very far. But that's one of the problems in this space because the experience is so different and everyone's symptoms are slightly different to the next person. Clinicians might not recognize these symptoms as potentially being caused by a UTI or by something else in pelvic health. So patients are often left just knowing that something's not right and not being able to find answers. And a lot of people in this community end up working with integrative or functional medicine practitioners just because they want to start looking across the board at everything that could be going wrong or
Hmm.
could be contributing to this, because it's not as simple for them as taking antibiotics because their symptoms just don't stop or they keep on returning.
Yeah. So, what age group are you seeing to be affected more often than not with UTIs? Do you see it in young kids? And what about men? Where do they fall into this?
There are different ages where you see a higher prevalence. So it does happen to quite a few children, but we deal more with adults and UTI. So we see it happen more to people in their early 20s, which could be because of changes in sexual activity or
Mhm.
lifestyle. But the main age group where this happens is around perimenopause and menopause. When the hormonal changes start to take place, UTIs can increase significantly. And there's a lot more research around that age group as well and what kinds of treatments might work. Like using vaginal estrogen, for example, has been shown to be the most effective treatment for UTIs at that age. And
Mhm.
then when it comes to UTI in males, the statistics say that only around 15% of UTIs occur in males. So it's generally considered to be complicated or more serious if a male has a UTI because it's so much less likely.
Mhm.
Therefore, their treatment and their testing approaches will be different to
Mhm.
what is used for a female if she has a UTI. And we have done some research into those differences in experiences and how people are treated when they go for help if they're male versus female. And it is quite a stark contrast in some cases.
Mhm. I saw on your website that you have a statistic of 7 million women experience UTIs in the USA each year, which is insane. I don't
Hmm.
suppose you have the statistics for Canada.
Yeah, I don't. And it's part of the reason is that it's very hard to find statistics. And I think since then it's actually 8 million in the US. But the most recent research we've seen is that 404 million people each year have a UTI, and about 90% of those are female. But to find breakdowns by country is almost impossible in some cases. So you might be able to find that it's the second most common reason for prescription of antibiotics, and that's what it is in the UK. But you cannot find statistics that will tell you how many people suffer recurrence or have continuous symptoms of UTI. And that's something that we would like to change so that we can better kind of convey what's going on in different regions in the world.
Maybe some sort of subscriber or survey participation or something like that. I would
Yeah, we
be
definitely need
interested.
to gather more. Yeah, me too. And we get this question a lot from researchers around the world. Do we have any stats on their region? And we just can't find them.
I think it's because most of the research is done on the states overall. There is a lot of research on China and India, but
Mhm.
the smaller countries, even though Canada is big, the population is quite small, kind of
True.
get overlooked. And because we're next door to Canada, it's like, well, if it's relevant for the state or relevant, we're next door to the states. If
Yeah.
it's relevant to the states, it's relevant to Canada. Um, but
Yeah.
however, so I do wanna look at different triggers
Hmm.
for UTIs, but I do wanna come back to the stress factor
Yeah.
'cause, stress is the driver of everything nowadays.
Hmm.
So, you can share in your experience if you want how that stress triggered it in you or overall what you see or know to be a factor, like, why is stress driving this?
It is an interesting one, and it's like we kind of know a lot at this point about the the gut brain axis and that connection. And there's starting to be some research that suggests there's some kind of connection between the urinary tract and mental status or the brain as well. But there's nothing directly linking stress to UTIs, more indirectly. And we do hear this a lot from our community that people report that they think their UTI symptoms flare up when they're stressed out, or that their first UTI occurred when they were during in a period of stress in their life. And that was certainly the case for me.
Mhm.
When this 5-year experience started, I was more stressed than I'd ever been in my life.
Mhm.
And I think in some ways the stress also feeds into the decisions that you make. So it might not only be the stress, but when you're stressed, you start to make decisions about what you eat and the
Mhm.
sleep that you don't get. And so for me, it was probably a lack of sleep, changes in my diet, the stress itself, and maybe some other factors that I wasn't aware of at the time. But it does seem to be a really significant contributor for a lot of people. And so we have done some work with health psychologists looking at ways to kind of do interventions to help with that so that you can practice mindfulness or have some kind of approach where you can try to address that before it gets worse. But it's one of the areas that really needs more research.
It really does. And stress, as I still think there's that whole woo woo notion around stress of it's
Yeah.
just a feeling that now I'm starting to think we're at, because we talk about stress so much, people are almost at the page of move on, please.
Yeah.
That, like, I hear about stress all the time. There's only so much I can do about it. Stop telling
Yeah.
me to meditate. Stop telling me to, like,
Yeah.
people are just fed up, which is understandable, but that does not mean it's not relevant. And we know in the research that when people are going through times of stress, that's when they're more likely to get a cold or a flu,
Hmm.
or worse, depending on the person, because
Yeah.
the immune system is compromised,
Yeah.
because you're taking away all these different resources and utilizing so much energy to deal with the stress. Like, when you're wired and you're dealing with a lot, like all your focus is on that. So all your energy is on that.
Hmm.
And one thing, just for the people listening, for example, in the likes of genital herpes, when someone gets a breakout, it's usually during a time of stress. And to touch on what you mentioned, it's not just the stress factor, it's what are you doing to
Hmm.
soothe the stress when you're experiencing it? Are you maybe drinking more alcohol? Are you
Yeah.
getting more takeout? Are you eating more junk food to, like, self-medicate?
Yeah.
And with genital herpes specifically, we generally see that a breakout is due to some sort of stress that's affecting the liver. And it's usually
Hmm.
after someone's had like a crazy weekend of drinking or binging,
Yeah.
because the liver is compromised and then they get a genital breakout.
Hmm.
So there's a lot to be said for the whole, like, downstream effect, for sure. What other triggers are there, if not stress? Like, are there food triggers? Is there a
Yeah.
no, I'm sorry to just stop you. A big thing here, I don't know what it's like in Australia or where you are now, but in Ireland, hot tubs are not a thing ever. Like,
Yeah.
we're like, oh, what's a hot tub? You'd only see it at a gym or something. But in
Yeah.
Canada, hot tubs are a big thing. Every
Hmm.
second neighbor has one. And I know there's a lot of concerns about that because I see BV getting
Hmm.
triggered by hot tubs. So,
Yeah.
yeah, sorry, the triggers.
I mean, it's a good one. Hot tubs fill me with fear now because we do hear from a lot of people who say that's how it started for them, a hot tub, or people who now cannot go in a hot tub without it triggering a UTI. So there's clearly a association there for a lot of people. And I would not go in a hot tub anymore. I've definitely done it in the past, but now I second guess everything. But a lot of people, if anything you could think of could be a trigger. So we've heard triggers like horse riding or drinking coffee or alcohol. That's much more obvious, but some specific dietary things, like just one particular food that someone eats, will trigger their bladder symptoms, which could indicate a sensitivity rather than an infection. But that's kind of the nuance of this is difficult. People don't often know if it's an infection or something else that's causing those symptoms. But sex is a huge trigger. So that's the main trigger that people talk about. A lot of people cannot have sex or penetrative sex without experiencing a UTI. And so that's a big topic that we try to address with things that people can try. But there's also the possibility that organisms are being transferred during sex, rather than it just being something to do with the person who experiences UTI. It could be something to do with their partner. So that's another thing that people have started to investigate. And we do hear from some couples who have found a solution by both people being treated, for instance.
Mm.
So there's a lot of things to consider. But the hormonal aspect of this is huge too. And it's not just for people in perimenopause or postmenopausal. We have seen that a lot of people experience UTI symptoms at certain types of their menstrual cycle, for instance. And for some of those, having hormonal therapy has actually helped. And so it's maybe like mostly clinicians will prescribe vaginal estrogen, for instance, for people in perimenopause or menopause, but for some younger people, that can be the answer. And in my own case, I also suspected I was having hormonal problems. And so I stopped taking the contraceptive pill. And I think that was a significant factor in my recovery because it helped my body to just get back on track in a natural way, in combination with my dietary changes and other things that I implemented. But I have not gone back on a contraceptive or hormonal pill since then because I felt completely different once I came off it. And that experience has been mirrored in other people that we've heard from, that either starting the pill or stopping the pill has been what has helped them recover. And that also highlights that there isn't one approach that will work for everybody because those two are obviously the opposite. And so we have to really think about it when we talk about our experiences, that what I experience is not necessarily something that you should try, but you could still consider how that might impact your own recovery.
Mhm. It's interesting that you mentioned the pill because we know most of the pills are usually more estrogen dominant, and the research shows us that a lot of these pathogens are attracted to estrogen as well. Now, estrogen in the context of perimenopause and postmenopause, we could debate and discuss that on a different matter, but for sure in younger girls getting
Mm-hmm.
put on some sort of birth control, and they've already got high levels of estrogen,
Mm-hmm.
and now to add in more estrogen, we see this with I don't know if you've ever seen, as gross as this sounds, pictures of UTIs being taken out of women with chronic yeast infections, and the whole UTI is covered in like this scaly mold of yeast, and it's because the pathogens are attracted to the estrogen that it's given off. And
Mm-hmm.
there's a lot to be said for estrogen, and we could agree or disagree, but different contexts for sure, depending on the age.
Yeah.
But I think there's a big problem there. And you mentioned endometriosis yourself. I wonder if the pill was the trigger for that happening in the first place.
There's no research to suggest that that is possible. And my symptoms started when I was much younger. And I think the symptoms I was experiencing when I was a young teenager is what led to me being put on the pill in the first place. And then that pill probably masked some of the symptoms of endometriosis. So it wasn't until later, once I'd stopped the pill, that those symptoms slowly started to return. And that's when I ended up having surgery for endometriosis. But I'm still glad that I did stop the pill because it was causing me all sorts of other problems.
Mhm.
And also, it's not necessarily great to take estrogen if you have endometriosis. But of course, at the time, I just went through what most people with
Mhm.
endometriosis go through, a lack of diagnosis and clinicians who put everybody on the pill when they have a
Mhm.
problem with the menstrual cycle.
Yeah, and a lack of understanding as well. So I
Hmm.
wonder with the intercourse aspect, when you say when both partners get treated, the problem seems to subside or improve. I wonder if the male had an infection the whole time, but one, men are more resilient on every level, like even their skin is thicker. And men also don't have the body awareness that women have, that maybe they don't recognize that there is something even wrong there. And it's just being passed back and forth all the time. So it's interesting.
It is possible. It's also the case that the male urinary microbiome and the female urinary microbiome have different dominant species. So
Mhm.
something that could be perfectly normal in the male urinary microbiome may cause an issue for a female partner. And males can have different levels of organisms and be asymptomatic. So they may not have any symptoms at all, but the same organism could be causing symptoms for their partner. So treatment for the male is not necessarily to treat symptoms, it's just to treat that organism so that it stops affecting their partner. And we
Yeah.
do work with a few clinicians who are doing research in this space and finding that for some couples that really is the case. And so it is something for some people to consider. It's not always the problem, but it could be. And we do hear stories from people who have never had a problem with UTIs after sex until a specific partner. And that's the kind of situation where a clinician might suggest that you should potentially investigate that further.
Would you classify a UTI then as a form of an STI?
Not in the traditional sense, but I do think it's not helpful to say that UTIs can't be sexually transmitted. Organisms are clearly transmitted back and forth during sex. It's sex, there's bodily fluids, there's everything touching. It's just the notion that it's a sexually transmitted infection like that. It's more just the sexually transmitted organisms. And then those may cause problems for some people. But
Yeah.
it's also likely that that is not what's happening for most people. It's just a subset of people that might find a solution by investigating that.
So you mentioned when you were in Greece, you had no alternative but to look for other options because you didn't have access to a practitioner. So I know someone's going to be asking, what were these other options? And then maybe we can talk about some of the more common options that are
Mhm.
used.
So for me, alongside UTIs, I had also had candida infections, like yeast infections, for much longer than I'd experienced UTIs. And that was not all the time, but it was quite frequent. And through the UTI experience of taking all the antibiotics, that I think exacerbated the yeast problem.
Mhm.
So at some point, I decided that yeast was a big problem for me, whether it was causing the UTIs or not. It was definitely contributing to all the symptoms I was experiencing. So one of the big changes I made was to go on a diet that was anti-candida. So I cut out processed sugar. I actually went vegan. I was pescatarian at the time, but I changed to a vegan diet, cut out all processed sugar and all grains as part of that candida approach. That diet really changed things for me. I'd been diagnosed with irritable bowel syndrome as a teenager, not knowing at the time that that's really a diagnosis of exclusion and that
Mhm.
it's not a specific illness per se.
Yeah.
I had had that for about 15 years by the time I started this diet. I have not had that problem since. And I think the diet itself changed a lot about my whole body. And then taking natural antimicrobials, and I also use vaginal probiotics and oral probiotics. And I think that helped to reset things too. And the combination of all of those, plus identifying a few nutritional deficiencies that I had, like B12, for instance, I started to address things like that, just smaller aspects of my health. And when it all got put together in the right combination, I suppose, that's when I started to recover. But I had been trying bits and pieces of all of this for that 4 or 5 year period. It was just when I hit that right combination that I really started to feel well. And then I didn't look back after that. I'd continued to improve over that time.
Mhm.
And I've continued with a lot of those things too. I've still kept to a similar diet. I really don't eat a lot of sugar and I'm mostly vegan. And so that has just been what's worked for me.
Mhm. So what I know someone's going to want some examples with these natural antimicrobials. Were you using like wormwood, rosemary, tea tree?
I mostly used oil of oregano. So that's quite a strong antimicrobial, and it's not usually recommended to use it over a prolonged period of time. But I mentioned that functional GP that I found, and she was the one to suggest that because she thought it might be helpful. It has a strong antifungal
Mhm.
action to it.
Mhm.
And so I used that for a number of months, and it really did help for me.
Did you try Saccharomyces boulardii at all?
I did, and oddly, I always react to that. It always gives me digestive problems. So I think I have probably a sensitivity to yeasts in general after having this problem with candida.
Mm. Or did you try a couple of different products of the
Mm,
Saccharomyces?
I
Yeah.
did, and I've tried them over a number of years as well because it always comes up as a good thing to try, but it has not worked for me. I know a lot of people do benefit from it.
Yeah, they do. Um, Before I kind of give you more examples of what I tend to use with my
Hmm.
clients, what do you see, apart from antibiotics, that's generally recommended to people, more generalized if we're looking at conventional medicine?
Hmm. So there's a prescription medicine. It's a prescription in Canada and the US at least, so you can get it over the counter in Australia, New Zealand, and sometimes in the UK. It's called Hiprex, which is methenamine hippurate, and it's a urinary antiseptic that's actually quite old, so it's been around for a long time. But there have been some more recent studies where it has been shown to be quite effective for people with long-term UTI problems. That's the kind of medication that you would take twice a day for a long period of time, and you can take it over a long period of time, and it's been shown to be quite safe. And
Mhm.
we have a lot of information about that on our website and our YouTube channel because it has been so helpful for so many people in this
Yeah.
community. And so aside from antibiotics, that would be the main thing that people are recommended by clinicians. And then there's some other natural supplements that people use, like D-mannose or PAC, cranberry extract kind of products, which some people find really helpful too.
Yeah, I was going to mention D-mannose, and it tends to work well for most people, but not everybody. Uh,
Yeah.
one thing I have been utilizing with my clients and looking into a lot, I don't know if you have, is methylene blue. There's actually
Hmm.
some solid research, PubMed, I don't know if you use PubMed,
Yeah.
but on the efficacy for using different dosages of methylene blue, not just for UTIs, but all pathogenic infections.
Yeah, and that's another quite old urinary antiseptic. The problem is it's very hard to get. So I've used it myself and I have spoken to a few people who have gotten it, but it's just not available in a lot of places. So we don't talk about it a lot. But I do think it's a good option for a
Yeah,
lot of
we
people if
it's
you can
pretty
find
easy
it.
to get here in Canada and the
Okay.
States, and I know UK, it's pretty easy to get in the UK if you know where to look.
That's the problem, I think, knowing where to look because it's not that easy to track down, not in the kinds of dosages you would need to take long term.
Mhm. One of my colleagues, Keith Littlewood, you've probably never heard of him, but he has a site and they're based out of the UK. I believe it's
Hmm.
Reading, maybe.
Hmm.
And he sells methylene blue for
Okay.
UK and actually all European, because you can post through Europe. And it is in the correct dosages. It is in a tincture. So
Okay.
for those listening, that is an option. So, and his shipping is pretty good for anyone who's worried. For us here in Canada, you can just get it on Amazon. Like it's pretty easy. Or
Hmm.
there is, not to be telling anybody to go to an aquarium, but
Yeah.
methylene blue is used to clean fish tanks.
Yeah.
And usually it is still USP graded. So maybe, I don't know.
I'll have
Uh,
to get the website of your friend so that we can share that information because we
yeah.
do get quite a few questions about methylene blue.
Yeah. And I think you probably have a lot of followers in the UK as well, I would assume.
Yes. Yeah.
Well, for sure, Ireland, yeah, and that would cover Ireland. He
Hmm.
can ship to Ireland too, so that would be a good resource. I'll pass it on to you.
Yeah, definitely. I can share that.
Um, is there anything that you'd like to touch on that people don't consider with UTIs? I know this is a bit of a tricky question, but um, anything that people, not just in the supplement realms and how it affects their lives, but st something we should know about UTI that nobody else is talking about?
I think something that is really important that's not often covered in mainstream content about UTIs is that standard UTI testing methods are not very accurate. So it's very possible to have a UTI and to get a negative test result. And
Mm.
that is one of the issues in this space. There's the dipstick that you're probably familiar with, it that you just dip in a pot of urine
Mhm.
is like accurate in maybe 30% of cases. And when it comes to standard urine culture that's sent off to a lab, it's only up to 50% accurate as well. So there are a lot of people who are being told they don't have UTIs when they in fact do. And I think that is a really good mindset to go into this problem with, and then to try to educate yourself around that, or what alternative testing methods there might be, or what you can do if your clinician actually just gives you no options because your test result was negative. Patients really need to educate themselves and then advocate for their preferences because this is not common knowledge even amongst clinicians, even though plenty of research has been done in that over the last 10 years or so.
What are some of the alternatives apart from the dipstick, which you're correct? The client I mentioned to you at the start of our conversation,
Hmm.
she didn't have a UTI on one
Yeah.
test, but the next test she did, and it's clear she does.
Yeah. That happens a lot. So there are other ways that you can get testing. So in the UK, you can get an expanded quantitative urine culture, which is a type of culture that uses different media and like anaerobic, and over
Mhm.
different time frames so that it has more chance of culturing what's in the urine. Then there are sequencing techniques, so like PCR testing or NGS or whole genome sequencing, which look at the DNA fragments in the urine. And that can pick up a lot more because it's not trying to grow anything, it's just looking at what's there. Some of these testing methods can be quite expensive. And so you really have to look and see what's available in your region. But we can also share information about that if people want to reach out.
Mhm.
And that has helped a lot of people find a way forward, especially if the organism that appears to be causing their problem is something that cannot be cultured. It would never show up on a test and they would therefore never get the right antibiotic for it. And so we have heard from a lot of people who have pursued more comprehensive testing and found a different type of treatment and then have been fine afterwards. For some people, it can be as simple as finding the right antibiotic.
Yeah. And unfortunately, the generic doctors are not going to be doing these expensive tests. So we have to do our own research and pay out of
Mhm.
pocket,
Yeah,
unfortunately. Or not,
that is often the
unfortunately.
case.
Mm.
Yeah, it's a tough situation because it can be financially draining for people to have this kind of illness and have to pay for tests and treatments over and over. Some insurance networks in the US do cover these types of tests, so it differs per country and the costs are always different everywhere as well. But for some countries, you'll have to try and find a test base somewhere else and ship the kit to your house
Mhm.
because that's the only way you can get that kind of testing.
Yeah, and probably one of the great things about current technology and what's accessible now is we can do a lot of at-home testing ourselves. That
Mhm.
is pretty reliable.
Yeah, and it's helpful too to be able to pee in a cup in your own bathroom instead of under pressure in a clinic.
The last time I peed in a cup was when I was pregnant, and I don't know if you know the routine, but every time you go for your checkup, you have to pee in a cup, and every single time I would pee on my hand. Every
Yeah,
time. I
yeah.
just could not get that angle correct.
It's hard to get it into that little cup. And then there's always the question of, is it enough? Is it too much? Nobody really knows. There's a lot of pressure on the spot. So
Yeah.
it's kind of good to be able to keep a kit on hand and then pee as soon as you need to once you feel symptoms. That
Mhm.
also means you don't have to wait to get to the doctor to try to get treatment. You can take a sample straight away. So a lot of people like to just have a kit on hand at home
Mhm.
and
Yeah.
do it like that.
So I wonder, have you and your team looked into the connection between low thyroid function and UTIs?
We have tried to look into whether there's much research into this, and I can't find anything specific to UTIs, more just chronic infection in general. But with my own experience, after I had the endometriosis surgery, one of the things that happened is that I developed Hashimoto's thyroiditis. So
Mm.
I've also had this chronic UTI Hashimoto's thing going on for the last couple of years and trying to look into different ways to address that. And for me, I think that I can just feel that connection because my thyroid and my bladder symptoms seem to sway together. And so it would be really interesting to see that research done because there are clinicians in this space who talk about that connection. Like if there is a thyroid problem, it could be one of the contributors to the bladder symptoms, and that the bladder won't recover until the thyroid problem is addressed.
Well, I wonder if you always had a thyroid issue and
It's
that
likely.
was the trigger for everything. But then with the rolling stress, it just then evolved with the IBS and then into these chronic infections, because low grade infections are associated with low thyroid because, again, back to the energy, if the thyroid's not working, your immune system is not going to be
Hmm.
optimal either. And
Yeah.
Dr. Broda Barnes has spoke about this, so he was one of the main thyroid researchers
Hmm.
uh, back a couple of decades ago, so about 50 years ago. And he did mention that people who are treated for hypothyroidism generally saw their UTIs cleared up. And I'm sure you'll agree, most practitioners, most doctors are not even going to consider something like that for a
Yeah.
UTI at all. And
Yeah.
it's hard enough as it is to get even tested for thyroid.
Yeah.
But definitely a consideration, because we can have thyroid issues forever since we're
Hmm.
born, but not actually experience symptoms until
Yeah.
something happens. There's always a trigger there
Yeah.
somewhere.
Yeah, I think that's correct too. I'm sure I've always had some kind of tendency towards it, at least, even if you couldn't pick it up on an antibodies test. But it was that sequence of things that happened that really brought those symptoms out and then led to a diagnosis of Hashimoto's. But
Yeah.
I think it has probably been there always, just like the endometriosis that wasn't diagnosed until it got worse or until other things played into that.
Well, this has been fascinating. Do you have one tip, even a little tip for people who are struggling with chronic UTIs that you would like to leave us with?
I think it's important for a lot of people to connect with others. And there are a lot of support groups online that you can find, and you can chat to people about things you're considering trying or experiences you've had. Or you can reach out to our team, and we'll always write back with tips or resources that might be helpful. So I think the biggest tip is that you're not alone in this problem. It is one of the most common adult infections in the world.
Mhm.
And there are other people with similar experiences that you can connect with.
So I'm going to share the link to your website in the description, and you do have a free UTI quiz as well that people can take if they're unsure or back to the testing. Maybe your test said you don't have a UTI. You could take this quiz, and it might help to give you some sort of direction. What other resources is your foundation offering?
So we can connect people with clinicians. We have been developing a network of clinicians over the last 7 years. We have a lot more in the US and Canada and the UK than other countries, but we're working on that.
Mhm.
So we can provide information for clinicians who specialize in this. We also have downloadable resources that you can take to your doctor to help explain the problems with testing and treatment, and a worksheet to help you prepare for an appointment, to think about the questions you want to ask and what your preferences are, and so that you can advocate for yourself, and a lot of educational materials on the website and interviews with experts on our YouTube channel that will talk about the latest research, because that's really the only way you can find out about it, is to actually listen to the people who do the research, because it is not going to get through to clinical practice for quite some time. So we just try to make sure people are aware of the changes and improvements in what's going on.
I think you mentioned that you can help direct people to sourcing some of these more unconventional tests.
Yes, we can provide information about that too. And we also have some lists about different supplements and products that people in the community find helpful. So, whatever you need, you can reach out and we'll do our best to find the right resources for you.
That's fantastic. Like that really sounds like a great resource for people. So I'll be sure to share it and of course share the
Amazing.
conversation we've just had. So thank you for your time. It was exactly what I was hoping for, just lots of information for people. So thank you. I hope you have a great evening where you are while I just start
Thank
my
you.
day.
Yeah, enjoy your day too. And thanks for having me.
You're welcome. Thanks.